Hey everybody, welcome to our live stream and happy Friday. Today we're going to switch gears a little bit and talk about something a little bit different. Today I'm going to share with you a powerful, low-risk, non-surgical, natural way to help reduce or eliminate knee pain. But first, let me ask you a question. Have you or someone you love ever suffered with knee pain? Have you ever been told you need knee surgery? Or have you already had knee surgery but still experience knee pain even years later? Or have you ever wished that you could try a non-surgical procedure to get pain relief? Many people think that to get relief from knee pain and to be able to return to an active lifestyle, they need to get steroid shots or some kind of injections every 3 months or every 6 months. And that steroids have a lot of negative secondary effects for the knee and actually the whole body. I've talked about that a few times before. Or if they've already had surgery on their knee, they think they need to have another surgery or get the entire joint replaced in order to get significant relief from knee pain. So what if there was a way to have significant relief from knee pain that lasted a year or more without the harmful effects of cortisone or steroids or the risk and recovery time of surgery? Wouldn't that be amazing? Well, there is, and I can't wait to tell you about it in this Friday live stream video. But first, let me tell you about the power of how regenerative medicine helped the knee pain of my patient, Greg. So Greg was having ongoing knee pain and was told the only thing that could be done was a joint replacement. He'd had pain and swelling, pain pretty much all the time, and then swelling kind of intermittently over about 10 years. It was about 10 years before he came to see me for this that he was told, nothing can be done for the knee. It has to be replaced. It's bone on bone. You've probably heard that term before. And he was, he just brought it up with me. We were talking about other things while he was seeing me. He said, hey, I didn't mention this before because I was told there, by more than one surgeon that there's nothing that can be done for this knee. But what do you think? Is there something you can do to help me? So I got the MRI, and sure enough, his knee was definitely what you would consider end stage. However, he's a very active, healthy person, very functional. And so I was explaining to him about what some of the regenerative options are. So he opted for a regenerative procedure, and I did a combination regenerative procedure on his knee, treating both inside and the external structures of the knee, meniscus, ligaments, all of that. And that was 2 years ago. 3 years ago now with Greg. And that end stage knee of his has not bothered him at all. It's incredible. He's even been able to do heavy duty home remodeling, working with tiles and on the floor and up and down and carrying heavy things. And the knee has really held up. He was so surprised. And I hadn't had to retreat it. That was from one really complete treatment for his knee, and extremely pleased with that result. And he checks in with me at least once a year on that knee, and he's been doing great so far. So sometimes, even when in the traditional medical model, we're told there's nothing else that can be done, sometimes there might be something that could be done. So it's always good to investigate that. My other patient, Terry, she had both of her knees had been bothering her for about 5 years. 5 years of kind of continuous problems where every night she had to ice for about an hour, both of her knees, and she had pain at the end of every day, no matter what her activity level was. But if she tried to be more active, like golf or something like that, the knee pain was really, really bad, and it was really limiting her. She couldn't really even get down comfortably on the floor and get back up because of her knee pain. She was again told that one knee could probably be scoped, the other one needed to be replaced, and so we opted for a regenerative option, and I did a combination PRP treatment for her knees, and she did fantastic. She's about a year to a year and a half out now, and is having no pain, back to full activity with no icing, no pain. Doesn't even remember that she had knee pain in her knees. So sometimes there are things that we can do. Now, not always. Sometimes, surgery is the only route available, but for sure have that investigated, because I have multiple stories. Those are just 2 of them, of patients who were told nothing else could be done. And, and sometimes the steroid injection, if they get a steroid injection, it lasts for a really long time. That's one thing, but steroids really are not good for the joint. So if there's something that can be done that's not harmful to the joint, or that is actually a much more long-lasting and regenerative option, it's worth investigating. So I'm going to share with you now some pictures. I want to teach you a little bit about what the knee looks like and what kinds of things we're looking at with the knee. So let me come... Here we go. So this is a program that I have that looks at the skeleton, and I'm zooming in here on the knee. So as you can see, here is the patella, that's the kneecap, and this is the big femur, this is the tibia, and this is where the joint actually comes together. This is the weight-bearing parts of the joint. This is the left knee and this is the right knee. And this is the fibula, this is the smaller bone. So if we look at the joint itself, you can see here that there's a joint here between the femur and the tibia, but there's also a joint underneath the patella. And I see this so frequently, where that front of the knee pain, that going up and down stairs, sometimes the squatting, where the patella, the pain is really right underneath here. And there's cartilage here, there's a joint here, there's supposed to be some lubrication there. And this patella, let me try to give you a different view, because when the muscle here gets deconditioned or weak, or the ligaments, no, not muscle, let me look at connective tissue. The ligaments are no longer taut and holding this patella off the bone underneath it, then you can create an arthritis that happens there, a rubbing of the bone, and worse yet, you can actually create a spur. So this, let me go... So you can create spurring right underneath here from these bones kind of rubbing on each other when they're not supposed to. And if I go back to show you what the connective tissue looks like, so look at all the targets we have to stabilize a knee. All of these things with the capsule, with these supportive ligaments, and these are the external ones. There's big ligaments that run through the middle of the knee as well, but all of these structures that keep that knee from inappropriately moving on the bone underneath it, or from wearing on the bone and wearing out the cartilage. So you can see, look at all the targets we have. And when we do a regenerative procedure on the knee, all of these need to be looked at on MRI, preferably. I also look at the knee under ultrasound, and I do the procedure with both fluoroscopy and ultrasound so that we have a really complete imaging during the procedure. But this is a really important structure. These stabilizing structures are really, really important. And if you can imagine, if these all became looser or torn and never really fully healed, which ligaments and tendons don't have a great blood supply, so a lot of times they don't heal as completely as we would like them to, then you can have this movement, this kind of an instability that can create problems here. And not only pain, but it can actually degrade the joint. So let me come back here. So I'm also going to show you a few little studies. Actually, let me take you to the website first, because I want to show you some of the different things that can be done for knees. So this is the page on my website for knee pain, and it gives you a lot of information. There's another video here, and you see I go through a little tutorial in that video as well, just because it's kind of nice to be able to look at the structures that we're talking about and that could be causing some of the problem. So PRP therapy. So platelet-rich plasma is probably one of my favorite. It's affordable for many, many people. It's not in the realm of the more expensive regenerative procedures, and a very well-prepared platelet-rich plasma can really do a lot of healing. My approach with joints is that the inside of the joint is one environment, and then the outside of the joint is a second focus. And there's different technique to both, but both of them really need to be done and treated completely in order to get the optimal result. That's been my experience over the last 10 years of doing this. So PRP, here's a Q&A section, which I actually put there because I think there's a lot of people have the same kinds of questions, and you can really learn a lot about if you see yourself in this situation. Is PRP right for me? You're welcome to contact us and have me evaluate your history with your knee, your MRI, and then we go from there. Orthobiologics is something a little bit different. A lot of times orthobiologics are used in combination with PRP. But orthobiologics will include things like hyaluronic acid. So hyaluronic acid, for those of you who don't know it by that name, Synvisc, Euflexa, Orthovisc, those gel injections that we put in the knee. A lot of times Synvisc was probably the first one to market, and it was a series of 3 injections once a week, and then we did that every 6 months. Then they made a couple that are single-use injections. Euflexa is... I really like Euflexa because it's had, there were a couple problems with the hyaluronic acids with some patients. Only a few patients would have this happen, but they would have almost like a foreign body reaction to a foreign protein. They would have this big red inflamed knee, and it was very, very painful. So the Euflexa product actually filtered that out, and some of the other ones did too. Supartz is another one, so that didn't happen anymore. But the hyaluronic acid is it's really healthy for the inside of the joint. Now, it's not really treating the instability parts, the ligaments, and all those other things, but inside the joint where that synovial lining is, it's very, very good for that. And that's been shown pretty well in the studies. And I'll show you a couple studies that are used HA with PRP combined, which really showed some great things. Ozone is another one. Now, ozone is really interesting in a joint. Ozone is O3, so you have to use an ozone generator to actually generate ozone from air. And it creates this O3 molecule, which isn't very stable, so it doesn't last in that form very long, but it's an oxygen donor to an area, and it's also extremely antimicrobial. And ozone is really fascinating in orthopedics. Other things that are considered orthobiologics would be growth factors, like the amniotic tissue growth factors, umbilical cord blood. Those do not have living stem cells in them. They are growth factor matrices. So a lot of people get confused. They think that that's a umbilical cord stem cell treatment, and the cells are all irradiated. There's no living cells in those products, but they have wonderful growth factors, and that can be used really effectively to help with a knee procedure. And again, a lot of times some of these things are used in combination with each other. And then there's the exosomes, which is, I'll have to do, exosomes is going to be a whole other live stream by itself because there's a lot to know about exosomes. But again, exosomes are these granules. They are extremely regenerative. They are a product of cultured stem cells, and there's a lot of promise there with exosomes. So we also have cellular therapy, probably my favorite. Now, again, when you're adding cells, you're using cells. You can use cellular therapy along with PRP, along with some of these other orthobiologics to get yourself the most optimal chance for a great result. Most autologous cells are derived from either bone marrow or we have a technique that I've been working on for 6 or 7 years of isolating these same regenerative cells from your blood. So we don't have to go into your bone marrow to get this regenerative cell matrix. But the bone marrow is probably the most commonly known ways. Bone marrow aspirated cells are what they're called. And this is kind of a nice explanation for you. Just take a look, and it might answer some questions you've always kind of wondered about cellular therapy. Now here's one that's really interesting. Hydration, just IV hydration. You wouldn't think that just hydrating yourself could make your joints feel better, but I've seen it over and over and over again. The joint fluid wants to be hydrated. You don't want to have a dehydrated or dried up inside of a joint, whether it's a knee or any other joint. And just giving yourself that boost of hydration can sometimes really resolve some joint pain. And it's a very your tissues, most of us are walking around a little bit dehydrated all the time. We don't hydrate as well. Our water isn't as wet as it used to be. The pH isn't always optimal in bottled water and to absorb into tissues. So IV hydration, there's something to be said for that. And it's pretty simple. You just come into the clinic, we give you an IV of fluid, normal saline, plasmolite or lactated ringers, and you can feel better within just a couple hours. Shockwave. So Shockwave is another thing. It's using a high-powered It's just a very special machine that uses a very high-powered sound wave that's created by a bullet in a chamber. Hits the chamber, generates the sound wave. It sounds like a jackhammer. Well, that sound wave will pass through normal, soft, water-based tissue, but as soon as it hits calcifications or spurs, those structures absorb that energy, and then it kind of dissipates that calcification for you without breaking it off and having a loose body somewhere in there. And it also induces better blood flow, induces better oxygenation. So there are times when it's appropriate to do Shockwave prior to a PRP procedure, like when there's specifically inflammation or edema in the bone itself that's right around the joint, usually in the tibial plateau. So sometimes that's a nice adjunct, and it's been studied actually. Shockwave prior to PRP, when that inflammation in the bone was present. That study was published about 2 years ago. So K-laser is another one. So K-laser is probably the least invasive thing we have. It actually feels really nice. It's a warm laser. It's a class 4 laser. And what it's primarily doing is it's helping to modulate inflammation, improving blood flow, improving mitochondrial function at the cellular level. So if you're having inflammation, pain, a strain, like if you have an acute injury, this is a wonderful tool to use early on. And there's no reason to not use it when it's a chronic problem as well. One of the things about laser is it can activate PRP in a certain way. It can actually create the environment for your PRP to work a little bit better. And it's been shown, the reason I like this laser so much is this is the one that's actually been shown to help reduce some post-procedure discomfort for people who are really kind of struggling with that. So please visit that website if you'd like to look at that. Let me see if I have, it's drheather.net/knee pain. So some of the other things that are actually really helpful for knee pain are hormones. If your hormones are not optimized, especially testosterone and growth hormone, but we'll talk about testosterone. Growth hormone, you can actually optimize using peptides that can help your body actually release some of its own growth hormone, not necessarily using exogenous growth hormone or external growth hormone. But the testosterone, when your testosterone's not optimized, it's very hard to have your joints have a natural recovery. There's a lot of testosterone receptors that are there, and we call that our hormone of recovery. So if you notice that you just seem like you're getting injured a lot more, strains and sprains, things that never hurt you before, all of a sudden are kind of bothering you, you may want to think about having your hormones looked at. Having hormones kept at an optimal level, not a super therapeutic level. We're not turning everybody into Superman, but keeping them at an optimal level can really help your body repair those tissues as life brings its challenges. The other thing is, of course, peptides. You know that I love my peptides. We actually have a really, really nice regimen for knees in particular. There was a peptide combination with AOD, 9604 plus hyaluronic acid. It was made together, and it just did wonderful for patients. AOD isn't something we can get right now. We're hoping to have that back soon, but that's a peptide combination that was wonderfully effective for internal joint pain. Pentosan polysulfate. I know I just talked about that recently. Pentosan, we've had just tremendous success with knees, shoulders, hips, hands, fingers, neck, back. It's really an amazing peptide. It is designed to help reverse, well, it's not designed, but what it does, its mechanism of action is it actually can reverse the degradation of cartilage and help, so you're building new cartilage, and it can help slow down the whole process of the cartilage loss. And M-Sculpt, so particularly with knees, remember I showed you the picture. I'm gonna do the studies next. The picture here of, let me put some muscle on this so you can see what I'm talking about. Oh, I'm gonna have to go each individual muscle. Okay. So these are big muscles, and you can see how important they could be incorporating into the knee joint. Okay. One more. There we go. One more. There, okay. So how important would it be to keep the patella where it's supposed to be, to keep the knee protected, to make sure that this muscle doesn't get weak? You can imagine that if this is weak and not engaged, look at how this could be stretched out, kind of not stable here, not stable here. The muscles that are involved with the knee are really important to keep them strong to protect the knee. It's never too late to work on strengthening muscle. So the M-Sculpt machine that I mentioned to you before uses high-FEM technology, high-intensity focused electromagnetic energy that actually causes a full contraction of these muscles. So we can use the paddles, and I've done this successfully with patients who have what's called patellofemoral syndrome, where the patella is just laying on that bone underneath it. It's very hard to get that better without shoring this up. I like treating the knee to get those ligaments nice and taut again and refreshed and new, but getting this muscle strong can be really challenging for patients who have knee problems because they're limited with what their mobility, they're limited with what they can do. We can use the paddles here and literally get all those muscles much stronger, and that is a really nice way to jumpstart keeping that knee from becoming a problem again. So let me show you just a couple of studies. This one looked at, most of the studies, by the way, are done with platelet-rich plasma. We don't have near as many studies done with bone marrow aspirated or other forms of stem cells and regenerative cells for a lot of reasons. Platelet-rich plasma has been around longer. It's easier to do. It doesn't require you needing to know how to drill into bone marrow in order to do it. And we're getting caught up with studies with bone marrow. The other thing about bone marrow aspirated cells is there's a lot of different technique of actually getting the cells. If you pull too hard when you're removing the bone marrow, you can end up getting mostly blood and not cells. If you don't know exactly where you're going into the bone marrow, you may not get any cells at all. So there's a lot of difference in technique. There's a lot of studies about platelet-rich plasma though. Look at this one. This is a randomized controlled trial, which is our strongest, best kind of study. We like those. Comparing HA, which is the Synvisc, Uflexa, platelet-rich combo in the treatment of mild and moderate osteoarthritis of the knee. So I know some of you are saying, well, I don't have moderate, I have severe. We've got a study for that too. But this is the mild and moderate arthritis, trying to catch it early, always better. The conclusion, the findings of the study support the use of autologous PRP as an effective treatment of mild to moderate knee osteoarthritis. It also shows that the combination of HA and PRP, this is where we're using multiple modalities to get the best of both worlds, resulted in better outcomes than either one alone, the HA alone up to 1 year and PRP alone up to 3 months. So these results suggest that the combination of PRP and HA could potentially provide better functional outcomes in the first 30 days after treatment with both PRP and HA alone. So they're looking at through 30 days, but we're looking at 1 year to 2 years. We really want to get that longer lasting relief. And then for those of you who say, I have more than moderate, this study, grade 3 and 4. So this is the severe osteoarthritis. And this was in 2016. The other one was from 2015. And this shows, we propose in conclusion, this is a whole big study, but I'm trying to spare you some of the nerdy science stuff. We propose that the intra-articular inside the joint, HA and PRP injections as an optional treatment modality in grade 3 and 4 knee osteoarthritis in terms of functional outcomes. So pain control, can you walk better? Can you walk longer? For up to 6 months, when arthroplasty is a knee replacement, is not an option. So up to 6 months, that's pretty impressive, especially if you're just looking at intra-articular injections. So that's kind of exciting. So again, sorry, you weren't looking at the study at all. Here. This is the study I was talking about. Intra-articular HA with PRP in grade 3 and 4, osteoarthritis. The conclusion, that it's a good option. They propose intra-articular HA and PRP injections as an optional treatment modality in grade 3 and grade 4 osteoarthritis in terms of functional outcome and pain control for up to 6 months when arthroplasty is not an option. So that's knee replacement arthroplasty. You didn't get to see the other study either, did you? Well, here it is. Sorry about that. little gremlins in my system. So this is the study that was published in 2015 that was mild to moderate osteoarthritis of the knee. And their findings were that the use of autologous PRPs, that's your own PRP, of course, in mild to moderate knee arthritis, when combined with hyaluronic acid, had significant results, not only at 30 days post-procedure, but at 1 year post-procedure. And they basically compared it to PRP by itself or HA by itself. The combination was significantly better, symbiotic. So now you got to actually see them. And if you want to look these studies up, these studies are all available without charge. You can look them up, no problem. So if I hope this was interesting for you. If you're interested in having us evaluate whether you're a candidate for regenerative medicine, you know that I'm such a fan of regenerative medicine. It has helped so many people. And it's helped not just athletes and not just young people. It's helped people with end-stage joints. Not everybody is a candidate, but there's a lot of people that can be helped with it, that it would, just a shame that you wouldn't have a chance to have somebody evaluate you for that. So if you're in Florida or you're a patient of mine, you're close enough that you can come in and have me evaluate you, I'm happy to do that. I would love that. drheather.net/contact. And then just let us know. I'm interested in regenerative procedures for my knee. And if you're not in Florida, you can find a physician who is really skilled at these things and just, have them find out how do they process their PRP, what are their success rates, and just have that nice conversation, and maybe you'll be a candidate too. I hope so, because I would love for you to be pain-free without surgery and without steroids if that's possible, and back to regular active life. Well, that's everything. That's all I have for today. I hope that you have a fantastic weekend. I hope this was helpful for you. And if there's anything else we can do to help fill in the gaps of information, just let us know. Have a wonderful, wonderful weekend. I will see you next week. Bye for now.